Hey guys, welcome back to the channel. Got a little bit of a different one for you today. Some of my previous videos I alluded to the Achilles surgery I just had. Got my boot off right now to let my foot air out, but I'm still recovering from that surgery. One of the things that I really tried to do before my surgery to feel more comfortable, because this is one of the most important tendons in your body, is I wanted to go online and find out what's going to happen. And I really didn't find anything that made me feel comfortable. So I've decided that I'm going to show you how they conducted the surgery on my heel. Now I'll try to put a picture up here of the x-ray of the bone spur. So really it was a giant bone spur on the back of my heel. And that bone spur caused the Achilles to rub on it. So there are a lot of scar tissue built up on the Achilles. And then I think at some point the part of the spur actually broke loose, because when the doc opened it up and looked in there, he said it looked like it might have been attached to the, like, kind of loose against the back of the heel. So the only way to take that bone spur, which has been hurting me since for the last 6 years, misdiagnosed, by the way, as tendonitis. So this is the only way to fix it. Was to slice off the Achilles, peel it up, and then remove the spur and grind down the back of the heel. So I couldn't find any of that depicted online, so I decided I'm going to do it. So I went out and I bought this. Everything else I had here in the garage. So I think we're going to be able to do this just fine. The first thing, I think, before we get started is I want to make sure we're clean. So I don't want to contaminate the area at all. I already sprayed it down with brake cleaner. Yeah, it's a lot of alcohol in there, so I think we're good. So we're sterilized. Oh, maybe I didn't. Anyway, yeah, don't mind the fact that this isn't stuck down. So here is the heel. Here is the ankle, and this piece of weather stripping is going to represent my Achilles tendon. What I didn't get for this, I couldn't find a model that was affordable. I spent like 15 bucks on this that had the muscles built in. It would have been cool to have like fake skin and gore, but you know, here we are. We got the Achilles tendon. So this is basically it. As I was laying on the table, the doc decided he was gonna, well, he told me because he had to open me up. So let's go ahead and get to the surgery. I got the tools here. I got this. I'm pretty sure this Hyper Tough Walmart rotary tool is probably, I think this is exactly what he used. Don't quote me on that, but I think this is exactly what he used. And I think the drill also was this $25, or this is brushless, $40 Walmart brushless Hyper Tough as well. So again, don't quote me, but I'm pretty sure I got the exact tools. These gloves from O'Reilly are probably also exactly what he had, and I think he told me, yeah, I think he said he had the Milwaukee. He's a Milwaukee guy, so I'm sure he also had this old cheap set of Milwaukee drill bits, and I'm only going to use 2, I think. But before I get started, I'll tell you what he said he was going to do. Obviously, he said he was going to cut the Achilles off, peel it up, remove the bone spur, and you'll see the bone spur here in a second. I did affix it to the back of the heel. And then he said they have a strap. So this is the bottom of a grocery bag, like a cloth grocery bag. And the strap's going to go across, and then he said they're anchors. I think he said these like push pins, so these are some fender washers that I got. They should work. I had them in the thing. But just in case, to get the point, I will use some screws. So there's some self-tapping stainless. Obviously, got to be stainless. But they don't go in this very well, so I got a pre-drill. All right, let's get started. I'm sure, obviously, he had gloves on, and he probably had these safety glasses. They're probably just as scratched up as mine, so we're going to need these because when there's blood involved, safety squints don't work. So, yeah, here we are with my foot on the operating table, and this is the best money that Navy medicine can buy. And he took a scalpel. This looks about right. And he said he just cut my Achilles off just like that. Just like that. Yeah, and he peeled it up. So imagine that. That's the back of my leg. I mean, I don't know if it was only peeled up a little bit or a lot, but this extra piece is, I'm sure there was scar tissue, so I'm sure he did the same thing. So this is what he had. This is how he did. In my mind, I was on a lot of medication. So this is what I imagined he said it looked like, but I don't really remember. I was kind of blacked out. But he had to remove that first and shape the heel. So let's do that. So this is exactly what happened. This is obviously a dramatic representation, but he did peel my Achilles up after cutting it off and expose the back of my heel. He may have had to clean it like I did with brake cleaner and wipe it down, because there's probably blood and stuff back there. But I'm going to skip that part, spare you the gore, and I'm going to go ahead and remove my bone spur. Hot potato. I was only in surgery for an hour and a half, 2 hours, so I'm sure it was just that easy to cut my bone spur off. But he said he had to shape the heel, so I'll do that first. Man, that's perfect. So it looks normal, just like he said he would fix it. And then he put my Achilles back. So, like I said, he said that they used a strap to reaffix the Achilles. So I'm going to do that right now. So let's get this thing put back in place, shall we? He probably had an assistant to like hand him a tool, scalpel, drill bit, 7/16, 3/8. But in my case, all I'll ask for is a 10 millimeter, and I don't think he'd be able to find it in this garage. All right, now let's drill this side too. Let's just do 1 and 1 on each side. I was gonna do, the drill bits, the screws on one side and the fender washers on the other, but I think he used all 4 the same, but this is just again a dramatic representation for you guys. Oh, I think it's hitting. Oh, we're hitting something. I don't know if that's gonna work. I'm hitting one of the other screws, I think. So let's do it over here. Oh, there we go. Nothing in the way there. So this is tough because you got to hold this down. I wonder if someone else just like help hold this strap, because apparently some type of gluey, strappy. It's organic, and these fender washers, as you'll see here in a second, the ones he used. So now I have 2 hands. So maybe he did put 2 screws and then he went to town. But these fender washer thingies, probably don't need to be that deep, and got to wall it out a little bit. But they he said they dissolve, so he said they take a couple years. So I'm assuming they're just like these. Let's see if I can push them in there without. Oh, hold on. I'm sure he had a hammer. I had to call him and find out what hammer he used. He said snap-on. You can barely read it. He's not a fan of Icon, so he said he doesn't really go to Harbor Freight. So, oh, he was right. Snap-on it is. I don't know if an Icon wrench could have pounded this thing in like that. Man. So obviously the screw may or may not have been what he used. I don't think he described these fender washers, and he said this whole thing is going to dissolve. My body will dissolve it in like, did he say 3 years or did he say 8? Yeah, I don't know. In the next 10 years, it'll be gone, and my Achilles will be back to, oh, look at that. It's normal now. All right, so let me clean up my workspace. And let me make sure. Yeah, got all that residue. That was a lot of residue there. Make sure we're good. Whoa! Oh, that's the table. I didn't clean the table. All right, guys, there we have it. That's what my foot looks like now, except it's still kind of swollen, and there's a big scar here where he sutured it. But that is your bone spur and Achilles surgery procedure. So, like I said, this is exactly how the doctor prescribed it when I was 75% under the influence of anesthesia. So I also could have just thought this up in a dream. But he told me that he was going to peel it up and then put it back. So there's something, the truth lies somewhere in between. But it does look like this. So this is what my heel looks like, minus the, I wouldn't have minded the stainless steel. Stainless is a good look, but he said it's all, plastic. So I can go through metal detectors. And then these are, I didn't do that. But, that's it. Thanks for watching. If you're going to have this surgery, hopefully this taught you something, and you will understand how they reattach your Achilles once you get the surgery. I am 3 weeks. Yeah, I'm 3 weeks in, and I'm actually walking pretty decently. Obviously not the bending it this way. Bending my foot in this direction is the only thing that still hurts. So I am still very ginger and mostly walking around in the boot, except for around the house. So not flexing, not putting weight like this. But yeah, expect 6 months of recovery until you even think about running on it. It may take you a year. I'm not going to try to run on it for at least 6 months, maybe a year, because I used to love running, do love running. He said you might not ever run again. So we'll see. Thanks for watching. Like and subscribe. I don't know if I can ever do content like this again. I will. Thanks, guys. See you on the next one. Kobe. I missed.